Sometimes life feels like a lot. Stress,
Anxiety.
Social challenges.
complicated family situations.
Feeling alone or like no one gets it.
It's okay to not be okay. If you need to talk, the 988 Suicide and Crisis Lifeline is here.
Whether you're feeling overwhelmed,
Dealing with thoughts of suicide,
Using alcohol or drugs to cope.
or just need someone to listen.
You are not
alone.
at 988, trained crisis specialists understand what you're going through.
They're here to listen and talk through what's on your mind.
With no judgment.
Your mental health matters.
Your story matters. You matter.
Reach out anytime. 988 is here for you. Call, text, or chat the 988 Suicide and Crisis Lifeline, Missouri.
Only 56% of Missourians know that 988 exists, but every Missourian knows someone who has struggled or is struggling themselves. This is why we need 988 messaging champions. Missouri 988 messaging champions are passionate supporters helping to bring the message of 988, mental health advocacy, suicide prevention, and substance misuse prevention to the people who need it most.
What is the difference between 988 and 911? 988 was established to improve access to crisis services for anyone in mental health, suicide, or substance use related distress when they need it most, and offers connection to local services and resources. This is different from the public safety purposes of 911, where the focus is on dispatching emergency medical services, fire, or law enforcement for assistance. The vast majority of individuals who reach out to 988 do not require any additional intervention at that moment. While 988 and 911 serve different purposes and offer different services, they share a common goal: to get people in crisis the right kind of help.
If you need to talk, the 988 Suicide and Crisis Lifeline is here. The 988 Suicide and Crisis Lifeline understands that life's challenges can sometimes feel overwhelming and difficult to face. Whether you're facing mental health challenges, emotional distress, alcohol or substance use concerns, or just need someone to talk to, you are not alone. Call, text, or chat 988 anytime, day or night, to connect with a trained crisis specialist in Missouri. If you're thinking about reaching out, know that it's okay to take that step. You are heard. You are supported. You are not alone. 988 is here for you. Call, text, or chat the 988 Suicide and Crisis Lifeline, Missouri.
What happens when you text 988? First, you text 988. You will then fill out a quick pre-text survey. Then, your crisis specialist will listen, provide support, and share resources. All text conversations are free and confidential. A message from the Nebraska Department of Health and Human Services.
988 is more than a number. It is a message. It says, we're there for you.
When you are dealing with trauma, you have to look at this situation as a fire, and you want to put it out quickly, but sometimes you just have to come in the room with them and kind of guide them out.
When someone calls 988, I think that they can expect to find someone who's wanting to hear their story, who's willing to take the time to listen to them wherever they're at and encourage them to talk about, things that they've been.
The Missouri Suicide Prevention Network is an independent, nonpartisan, voluntary group of individuals, organizations, and public and private agencies who lead statewide suicide prevention efforts. The Missouri Suicide Prevention Network's collective purpose is to develop and implement the Missouri Suicide Prevention Plan, a blueprint for individuals and communities across the state to help guide concentrated, coordinated efforts to prevent suicide. Suicide is a critical public health issue that affects individuals, families, schools, and communities. Missouri's suicide rate is consistently higher than the national average. Preventing suicide requires everyone's commitment, from the individuals struggling with their own thoughts of suicide up to the systems and the communities that support them. A strategic approach that engages everyone at every level is our best hope to prevent further suicides in Missouri. MSPN was created in 2018 to reduce suicide through increasing coordination of efforts and implementing best practices for suicide prevention statewide. It is dedicated to promoting local, regional, and statewide suicide prevention initiatives that follow a public health framework and focus on evidence-based data, collaboration, and active community engagement. MSPN works to promote the 988 Suicide and Crisis Lifeline, produce data and media reports, and promote language shifts surrounding suicide, mental health, and substance use. Addressing social stigma, promoting health equity, increasing access to treatment, and reducing access to lethal means are all tactics that can reduce the rate of suicide in our state. If you want to get involved, join us for our quarterly MSPN community meeting where you can share your thoughts, ideas, and local efforts around suicide prevention. These virtual meetings are open to all. For more information, contact MSPN. Visit our website at mospn.org. For assistance finding a community behavioral health center, visit the Missouri Department of Mental Health website.
In a moment of crisis, sometimes the bravest thing you can do is reach out for help. At the 988 Suicide and Crisis Lifeline, we understand that life's challenges aren't always easy to face. Whether you're struggling with mental health, substance use, or simply feeling overwhelmed, you are not alone. Call, text, or chat 988 to reach a trained crisis specialist in Missouri, someone who will listen with care, support you without judgment, and guide you through whatever you're facing. No matter who you are or where you live, your mental health matters. Reach out to 988. Call, text, or chat the 988 Suicide and Crisis Lifeline, Missouri.
Deaf Lead is a safe space for anyone who needs support. We provide 24/7 crisis intervention, case management, interpreting, mental health services. All for victims of crime who are deaf, hard of hearing, deaf-blind, late deafened, and their families. We also lend our expertise to other victim service providers, individuals, and organizations to ensure that their services for crime victims with hearing loss are truly culturally and linguistically accessible. If you or someone you know is experiencing a mental health, suicide, or substance use crisis, call, text, or chat 988 for free, confidential, and compassionate support. When you call, text, or chat 988, trained crisis specialists will listen to your concerns, provide support, and get you the help that you need. There is hope. 988 for 24/7, confidential support. From the Missouri Department of Mental Health.
Many outweigh the needs of few. And I don't believe that. I believe that the needs of everyone should be valued and important.
Accessibility is so important. If we don't have accessible services, then it doesn't matter how good those services are if people can't utilize them. You can literally text the digits 988 to get a hold of us, to get a hold of a trained crisis counselor who goes through the same amount of training a 988 counselor who's answering the phone, or a 988 counselor who's answering the video phone. The training, the requirements, the standards that we hold everyone to are the same. Point of having chat and text, it is not a substitute. It is not like a Band-Aid for people who can't use the phone. It is another avenue to be accessible, to be inclusive. Text and chat is a very popular way to communicate in the real world. It's our responsibility as the people providing help and support to adjust to that. And that's what makes chat and text such a pivotal and necessary piece.
Who are Missouri's 988 crisis specialists? To best support Missourians experiencing a crisis specialists receive extensive training in suicide prevention, crisis intervention, trauma-informed care, and other essential skills. They are knowledgeable about cultural and personal awareness and ethical principles to ensure the perspectives, voices, and choices of the people they serve are at the center of their work. If you or someone you know would benefit from a conversation with one of our trained crisis specialists, call, text, or chat 988. You are not alone.
"988 is here to support you every step of the way. Depression, a substance use crisis, or any other crisis or challenge. 988 provides confidential support whenever you need it.
988 Suicide and Crisis Lifeline, Missouri.
I'm Brandon Anderson. I'm the Vice President of Safety for AGC of Missouri.
My name is Kirsten Sierra, and I get involved in the 988 Champions Initiative through the Missouri Suicide Prevention Network.
My name is Polly Rijas. I am the Director of Youth Development Partnerships at the St. Louis Mental Health Board.
Hi, I'm Rick Strait. I'm our current Missouri Suicide Prevention Network Chair.
My name is Dr. Cammie Connor. I am with Harris Stowe State University. I became a 988 champion. We had a big event held on our campus with the 988 team.
What does it mean to be a champion? Missouri needs passionate advocates to bring 988 and mental health awareness into their communities. And the more we raise awareness, the more likely people will be to use 988 and find the resources they need.
What does 988 mean to me? I think it's a beacon of hope for those that are struggling, having utilized services similar to it.
I've got to hear many stories of clients or consumers that have used 988 and the positive impact it's had in their life. I've had individuals that talked about calling 988 because they were struggling with thoughts of relapsing and it helped them not relapse. I've had individuals I've worked with that have talked about the loneliness they were feeling and just calling and connecting with somebody. So as a professional, I've seen great things with 988.
Knowing about Missouri 988, its services, and its operations is a great start. But for 988 to help everyone who needs it, we have to raise awareness.
This idea that there was going to be a 3-digit number that was as easy to remember as 911 was just huge to me.
Accessing behavioral health can be complicated and at times it can be costly. The neat thing about 988 is that it's free, no cost. It's a great starting point for individuals who are trying to navigate a system that could be a little complex, even for myself as someone who works in the field.
Everyone at one point in time will experience some sort of crisis and know that there is help out there.
After finishing this course, you'll be able to confidently answer the question, how can I help spread the word about 988?
What can you expect when you reach out to 988? The 988 Suicide and Crisis Lifeline is available 24/7 to offer you free and confidential support whenever you need it. The crisis specialist will answer the phone, introduce themselves, and listen to you to understand what you're experiencing and how it's affecting you. They will work with you to address your immediate needs, offer support, and connect you to local resources. Whether you call, text, or chat, We want you to reach out in whatever way is most comfortable for you. We're here to help.
The 988 Suicide and Crisis Lifeline provides 24/7 crisis support for you or someone you know. Whether it's thoughts of suicide, a mental health crisis, or a substance use crisis, 988 is here to help. There is hope. The Lifeline works. Talk with us. Call or text 988 or reach out to chat at 988lifeline.org. A message from the Missouri Department of Mental Health.
8 is a 3-digit number for anyone facing mental health, suicide, or substance use crisis, or if you are concerned about someone else. It's called a Suicide and Crisis Lifeline, but crisis means different things to different people. And as the prior speaker indicated, you don't have to wait for it to get bad enough. If it's a crisis for you, it's a crisis and you should seek help.
I can tell you that in the last 2 years, we've committed almost $30 million to 988, and that's how important it is to us. As my role as Lieutenant Governor, and all Lieutenant Governors before me, we are also the advocate for our state's veterans. And I can tell you, veterans crisis is incredible in this country as well. We lose 22 veterans a day to suicide. In Missouri, we have established evidence-based care continuum with 988 at its core, ensuring responsive crisis service accessible to anyone in crisis, anytime they need it, anywhere they in the state. Missouri is recognized as one of the top 10 states in the nation for call and response to calls and texts, and I can tell you that we've answered over 51,000 calls and 6,200 texts and 8,100 chats. That's a lot of people who are reaching out in crisis. Always people out there looking for somebody they can talk to, looking for that help, looking for somebody that tells them they love.
If you look at the data and in regards to suicide in our country, the national average is around 15 to 16 per 100,000 folks, which is not sustainable. We're losing 50,000 people a year in the country to suicide.
What does it mean to be a champion? Missouri needs passionate advocates to bring 988 and mental health awareness into their communities. And the more we raise awareness, the more likely people will be to use 988 and find the resources they need.
There are a lot of Missourians who are suffering with thoughts of suicide, and suicide is preventable. So we need to make sure that we are doing everything that we can to help those who need it the most.
Knowing about Missouri 988, its services, and its operations is a great start. But for 988 to help everyone who needs it, we have to raise awareness.
This idea that there was going to be a 3-digit number that was as easy to remember as 911 was just huge to me.
Accessing behavioral health can be complicated, and at times it can be costly. The neat thing about 988 is that it's free, no cost. It's a great starting point for individuals who are trying to navigate a system that could be a little complex, even for myself as someone who works in the field.
Everyone at one point in time will experience some sort of crisis, and know that there is help out there.
After finishing this course, you'll be able to confidently answer the question, how can I help spread the word about 988?
What is the difference between 988 and 911? 988 was established to improve access to crisis services for anyone in mental health, suicide, or substance use related distress when they need it most, and offers connection to local services and resources. This is different from the public safety purposes of 911, where the focus is on dispatching emergency medical services, fire, or law enforcement for assistance. While some 988 calls, texts, or chats may involve health and safety issues that warrant 911 assistance, the vast majority of individuals who reach out to 988 do not require any additional intervention at that moment. Research shows that fewer than 2% of calls to crisis lines require a connection to emergency dispatch services. The goal of 988 is to offer support in the least restrictive manner and the most comfortable environment possible for the individuals in crisis. 988 is intended to keep people safe in their communities and avoid unnecessary involvement of emergency services when possible. While 988 and 911 serve different purposes and offer different services, they share a common goal: to get people in crisis the right kind of help. 988 and 911 centers across Nebraska are working together to ensure transition between the two services when needed.
Sometimes when we're dealing with mental health challenges, it might seem like we can handle them on our own at first. When you're unsure of who to go to, just remember, 988 is there for you. Don't hesitate to seek support before it's too late. 988 Suicide and Crisis Lifeline, Missouri.
A menudo cargamos el peso por nuestras familias, por nuestros seres queridos, por nuestra comunidad, pero a veces ese peso se siente demasiado pesado. Estrés, ansiedad, depresión, pensamientos de suicidio, preocupaciones por el trabajo, el dinero o la familia. Estas luchas son reales y no tienes que enfrentarlas solo. La línea 988 de suicidio y crisis ofrece apoyo gratuito y confidencial en español y en inglés a cualquier hora de día o de noche. Cuando llamas al 988 y presionas 2, puedes hablar directamente con un especialista capacitado en crisis que habla español y te escucha sin juzgar. Ya sea que estés en crisis o simplemente necesites a alguien con quien hablar, el 988 está aquí para ti y tus seres queridos. Tu salud mental importa, tu historia importa, busca ayuda. Llama, envía un mensaje o chatea al 988.
The 988 Suicide and Crisis Lifeline provides 24/7 crisis support for you or someone you know. Whether it's thoughts of suicide, a mental health crisis, or a substance use crisis, 988 is here to help. There is hope. The Lifeline works. Talk with us. Call or text 988 or reach out to chat at 988lifeline.org. A message from the Nebraska Department of Health and Human Services.
The 988 Suicide and Crisis Lifeline is a 3-digit number for anyone experiencing a mental health, suicide, or substance-related crisis. 988 provides rapid access to crisis services through a connection to a trained crisis specialist. For free, confidential support, just call or text 988.
988 provides rapid access to crisis services through a connection of trained crisis specialists who will work with you to address your immediate needs, offer support, and get you connected to local resources and services if needed. It's also important to know that our crisis specialists won't judge and your information is confidential.
How effective is the 988 Suicide and Crisis Lifeline? Approximately 90% of people who reach out to 988 get the crisis support they need and do not require additional services in that moment. Missouri's statewide training curriculum was developed to empower crisis specialists to feel comfortable and well prepared to help those reaching out. If you or someone you know is experiencing a mental health, suicide, or substance use crisis, call, text, or chat 988. There is hope.